one is the vein, this one, and this is the artery. When I press, the vein is collapsed, but the artery remains open. Okay, so you can see here again, this is vein, and this lower one is artery. Okay, thank you.
Thank you.
Welcome to this informational video for passing double lumen catheter. Here in my hand is double lumen catheter. It has two ports, one for artery and one for vein. We are priming this set. Initially, we have to heparinize it with the heparin solution. I have to heparinize all the parts. One is the pricking needle. This one in my hand is guide wire. It is a key component of this whole procedure. So we have to prepare the local anesthesia that contain the lignocaine. We have to assemble all our items together. This one is whole set here. First one, the syringe is lignocaine, and the second one is pricking needle. The other one is guide wire. The blue one is the dilator, and other is the line. We also have to do the full aseptic techniques. You can use pyodine or separate swabs to clean the area to reduce the infection of MRSA or any other local germs that cause septicemia in this whole procedure. So local anesthesia, first of all we have to locate the two tendons of sternocleidomastoid. We have to reassure the patient. We have to suck back because we are giving lignocaine. This one is pricking needle. We have to prick lateral to the artery. If we feel the pulsations of carotid artery, and we have to prick lateral to that artery. This blood should be dark. If the blood is bright red, it means you have pricked the artery. So I am passing the guide wire through this pricking needle. We have to pass it to the almost 3 steps marked on the guide wire. Minimum 3 steps. We have to remove this syringe. Here this is dilator in my hand. I have to dilate the whole area. We can dilate it with the dilator. We can give nick with the blade as well. We have to dilate it once or twice so that the double lumen is delicate, so it should pass easily after the dilatation. Here my hands in my hands is double lumen catheter for the dialysis. This is the same method used for CVP line insertion, and more or less same for the temporary pacemaker for the heart block patients. The same technique is being used. The lumen or the CVP or the temporary catheter sheath is passed being over on the guide wire. One part of the guide wire must be coming out of the blue lumen, so that we should not end up with the guide wire into the jugular vein. So we have one end in our hands. I have passed the catheter. We should have to remove our guide wire. So this is the whole technique. I have to check the flow in both ports, whether it can give adequate flow for the hemodialysis, because the hemodialysis require 250 to 300 flow per ml per minute. We have to check the both ports, its adequate flow. We have to flush it with the heparin because otherwise it can be clotted. I have to secure all of the parts of the set used until I conclude the procedure, because sometimes there is a restricted flow. I should not waste any of the set part, guide wire or double lumen until the procedure is completed. So I have washed one port, and I have to wash the heparinized nervous line and the second port, so that the line should not be clotted and it should be wasted if I delay in washing the both port with the heparin. We have to clean it with the wet and dry gas to clean the area and prevent the infection overall. And these are the two ports. We have to close the both one. We have to lock these as well. We have to clean the whole surface area. And here we go for the stitches to secure. We have to apply two stitches for it. More usually the external jugular vein is just around the suture side, so be very careful in placing sutures. You should avoid pricking the external jugular vein during this stitching process. I hope you have learnt a lot in this video. In the next videos, I will be trying to guide you how to do the blind procedure of the double lumen catheter. I will be guiding you how to do the posterior approach in the temporary or CVP line catheter insertion. I will be guiding you the permanent catheter insertion into the internal jugular vein, and this is the right sided approach. Next time we will pass the double lumen catheter on the left side, because the anatomy is little bit different on the left side, and we have to select a large size catheter on the left side. So you guys must be supporting me with likes and commenting here. You should appreciate me so I can put more and more videos for my all medical families all over the world. Thanks a lot. I'm Dr. Kasper Said signing off from Pakistan. Take care.